Hey everyone, welcome back to the channel. In today's video, I'll be walking through my experience in learning to administer local anesthesia. My name's Connor and I'm a second year dental student at Roseman University's College of Dental Medicine. If you follow me on Instagram, you might have seen my clinic recap stories where I've been sharing what I'm doing in the clinic each day just to keep you posted and so you can learn more about what dental students are doing. If not, go follow me on Instagram so you don't miss out on those stories and see what life as a second year dental student is like and what we're doing in the clinic. In one of my stories, I talked about anesthetizing a patient for a scaling and root planing procedure, or an SRP. And for this procedure, I administered 6 different injections, 2 of which it was my first time performing these injections. And so I thought I would share a little bit more about the process in being able to perform these injections up in the clinic. The first thing that happened started all the way back in our first year of dental school when we had our anatomy courses. We had a general anatomy course as well as 2 head and neck specific courses where we took a deeper dive into the musculature, the cranial nerves, the lymph nodes, the salivary glands, and all of those structures that are in your head and neck so that we could have that foundation of knowledge for when the time came to actually be performing these injections. Over our summer break, we needed to work through the first part of our local anesthesia training. And yes, we really did have work to do during our summer break. In this first part, we talked about the basics of a syringe, talked about different needle lengths, talked about topical anesthetic, as well as talking about the maxillary innervation. So we talked about the MSA and the ASA nerves, as well as the greater palatine and nasopalatine nerves and those injections. For these injections, we needed to understand the landmarks you look for, the depth that you insert your needle, as well as the amount of anesthetic to deposit. Overall, this class was really well organized, and the faculty member who taught this course had some seriously great videos that really enhance the learning experience of this course. We did have an exam for this course, which was a little different because it was available over a few days' time to be taken at our own convenience. And this was taken at the beginning of August, which was actually on top of our endodontics class. The second portion of our local anesthetic class was completed at the beginning of October, and this was on top of our pediatric dentistry class. And this course focused on the inferior alveolar, long buccal, and PSA injections. We did also discuss intraligamentary injections, but I have yet to see one of those performed in the clinic. There was another exam for this course, which was actually cumulative, so it covered information from the first part of the course and this second part of the course. And even after that, we still had some work to do before we could perform these injections up in the clinic. Many of you may have heard of what is deemed stab lab, which is where you practice these injections on each other as students before performing these injections on patients in the clinic. Roseman did not have us do stab lab, and so our first injection was actually on an actual patient in the clinic, which was super nerve-wracking to not have had any practice before. But we did have this great foundation of anatomy and our 2 local anesthesia courses, which really provided a great understanding of how to be performing these injections. Let me know in the comments down below if your school did stab lab or if your school did something else to have you learn these injections. At the beginning, after having passed the assessments for our local anesthetic 1 and 2 classes, We were under the impression that we were then allowed to anesthetize patients in the clinic. But this was super unclear. We had some faculty saying that that was okay. We had students start performing these injections and other faculty coming and saying, no, you shouldn't be performing these. And so that is when the different quads came out with their different protocols in order to enable students to perform these injections without supervision. So at my school, there are 4 different quads or sections to the clinic, and from what I know, each quad had a slightly different requirement before being able to perform these injections on our own. So I'm only speaking from my personal experience, and the experience of some of my classmates might vary depending on which quad they are in the clinic. So for us, we had to observe an injection, we had to assist with the injection, we needed to walk through the steps of the injection, so talk about what landmarks you use to identify the area you're injecting, how deep to insert the needle, and how much anesthesia to deposit for your injection. And after we discussed the steps of the injection with the attending faculty, then we needed to perform the injection under this direct supervision of our attending faculty. For whatever reason, these steps were only deemed necessary for the IA nerve block and local infiltration, which I don't fully understand, but I'm sure they have their reasons. I feel like I had absolutely terrible luck throughout my process of getting passed off to perform these injections. I would show up at the clinic in the morning and I would look at our schedule to see if patients would be needing any anesthesia so that I could then pass off my injections to my attending faculty and be cleared to perform these injections on my own. And it seems like almost every time our patient would be requiring one of the injections that needed to be passed off, they wouldn't show, and so I'd be left waiting and waiting for a patient to actually perform these injections under the direct supervision of my attending faculty. But finally, patients came through, I was able to get these injections passed off, and now I'm able to anesthetize patients up in the clinic without any direct supervision. I remember being so nervous every morning as I would sit in clinic anticipating getting my injections passed off and performing these injections on actual patients. And when the time finally came, I was kind of taken off guard. And so everything happened so quickly that I didn't really have time to think about it. I just had my foundation built and I applied topical and had the patient sit for a minute and then removed the Q-tip and then just inserted the needle. Everything went super smoothly and no problems with that first injection. And it wasn't really something that I had to think about, which was a big relief because up until that point, I had been pretty nervous just anticipating what it would be like to actually be doing this on a live patient. Up to this point, I have been able to do most of the injections that we have learned. The injections that I have yet to perform are a nasopalatine injection, a PDL injection, and an incisive and mental nerve injection. So there's still a few that I have yet to do, but I'm really happy with the experiences that I've had up to this point in my schooling. I mean, I'm only in my second year, so to have been doing injections for a few months now is really nice and has built quite a bit of confidence in my ability to administer anesthesia to patients. Long story long, this was my path to being able to perform these injections on patients in the clinic. If you are one of the 15 or 20 people watching these videos and you are interested in a series about how to perform these injections and the basics of these injections, let me know in the comments down below. And if you really like this video and you're new to the channel, don't forget to subscribe so you don't miss out on future content, and go ahead and follow me over on Instagram so that you can watch my clinic recap stories and see what I'm doing in the clinic on a daily basis. Seriously, if you made it to the end of this, thank you so much for spending your time watching my videos. It means a lot, especially being such a small channel, only a handful of videos out, 12 subscribers, but I really appreciate all of you who have shown support by liking, watching, and commenting on my videos. And I really appreciate it, and let me know if there's anything that you'd like to see in the comments down below.